Thank you for the opportunity to present our work entitled Physician Self-Reported Exercise Testing and Physical Activity Recommendations in Kawasaki Patients. Kawasaki disease, or KD, is a vasculitis of childhood. The characteristic clinical signs are those of inflammation and include fever, cervical lymphadenopathy, conjunctivitis, rash, and erythema of the mucosa and hands and feet. It is typically self-limited, but there is a risk of developing coronary artery aneurysms in 25% of untreated patients. Risk groups are classified by degree of coronary artery involvement as well as regression status. The natural history of coronary artery aneurysms is exacerbated by atherosclerotic disease, and thus long-term management includes measures to lower cardiovascular risk. AHA guidelines recommend that all risk groups are advised to have physical activity promotion at every visit. The only restrictions are that patients with medium and large aneurysms should self-limit their activity, and patients on anticoagulation should not play contact sports. Despite recommendations, we hypothesize there is variation in physical activity recommendations for patients with KD. We developed a survey with clinical scenarios of KD patients with increasing severity of coronary involvement and asked respondents about their practices. We had 28 physician respondents who care for KD patients, and respondents had a variety of backgrounds and experience levels. Our results are summarized on the following slides, in which the y-axis is number of respondents and the x-axis is degree of coronary artery involvement. Red represents no, blue represents yes. First, we asked if the patient was indicated for CPET. Respondents agreed that CPET was not generally indicated for KD patients without coronary artery aneurysms, but responses varied with increasing size of aneurysms and regression status. Respondents were hesitant to clear patients for physical activity despite guidelines recommending no PA restrictions, except for self-limiting for medium and large coronary artery aneurysms, and no contact sports if on anticoagulation. Lastly, we asked respondents about the types of physical activity recommendations they provide, and most report providing general physical activity recommendations. Specific recommendations are variably utilized. Overall, respondents were hesitant to promote physical activity and used CPET and specific exercise recommendations variably. We concluded that more explicit guidelines and communication of these guidelines to providers is needed to promote exercise in KD patients to improve their overall cardiovascular health. Thank you to survey respondents, and in particular, members of the International KD Registry, and a specific thank you to my mentors, Sada Tierney and Stafford Grady.